Good afternoon, everyone. Thank you for joining us today for this important announcement. We're joined this afternoon by Honorable New Rochelle Mayor Bramson, other New Rochelle officials, and representatives from County Executive Latimer's office. I'd like to introduce Carl Pagano, Carolyn Fortino from our County Executive Communications Department, who helped organize this event, and our County Executive Liaison, Aviva Meyer, as well. Thank you for being here. Let me begin by thanking New Rochelle Mayor Bramson, Police Commissioner Schaller, and City Manager Strone for their leadership and collaboration in this most important initiative. I also want to acknowledge our police officers and respect and appreciation we have for their efforts in keeping our residents safe and providing support, as well as their willingness to collaborate with our department, the Department of Community Mental Health. Creative programs such as police embeds do not happen without effective, innovative, and responsive leadership. I'd like to thank our County Executive George Latimer, Deputy County Executive Jenkins, Deputy Commissioner Joe Glazer, you'll hear from shortly, and also Mark Giuliano, our Program Director of Children's Mental Health Services, who oversees all of our police outreach team and efforts in training for police officers, as well as Chris John, our Dual Recovery Coordinator, who's also with us this afternoon. Let me give you a little information about what we're sharing today about police embeds. The program was started by the Department of Community Mental Health in 2005 in concert with the Yonkers and White Plains police departments. Over the past 2 years, we have doubled its presence in local departments by adding first to the Greenburgh Police Department and most recently now today in New Rochelle. We recognize that police officers often respond to people with complex needs and issues. This includes traumatic experiences, could be mental health and/or substance misuse issues, and general life stressors such as housing and other complex issues. The model essentially partners police officers with behavioral health, mental health workers to respond to calls and develop relationships with individuals in the community who need their support. By having a professionally trained staff work side by side with police officers, we're able to respond more effectively, address that individual's needs, and help perhaps de-escalate a situation and connect that person to needed resources in the community in a timely way. Our department also has the ability to navigate other behavioral health resources and other systems as well. The success of the co-response team is twofold. We're able to provide enhanced services and respond to community needs, while increasing safety for our police officers and our residents. We're excited about this new partnership and pleased to introduce our experienced treatment professional, Mary Manchard, who's here standing behind me, who brings many years of experience to the position. This is an exciting day for us as a department and for the New Rochelle community to create this partnership. I would like to take this opportunity to both thank and introduce our mayor, Mayor Bramson. Thank you.
Thank you very much, Commissioner Orth, and let me, on behalf of the entire city team, our city manager, our police commissioner, for whom we'll hear in just a short while, let me thank you and the entire county staff for being such wonderful partners in making this program possible. Like every sizable community, New Rochelle wrestles with the difficult challenges associated with homelessness, and those are challenges that exist on at least a couple of levels. On the one hand, we want to provide for public safety and the perception of public safety. We want public facilities and commercial areas to have a secure and welcoming and attractive appearance. On the other hand, and more importantly, we want to make sure that individuals who are burdened with homelessness are addressed in a fashion that is humane and supportive and provides people with a gateway to stable, productive, constructive, rewarding lives. Our police officers do an outstanding job every single day and approach issues of this kind with great sensitivity. But the reality is police officers are generally not trained and equipped to deal with complex mental health challenges. And that's why having county professionals who do have this kind of expertise, working hand in glove with our police officers, works in such a remarkable fashion. It helps ensure that on-site, in moments when this range of expertise is required, we're able to work closely together in order to achieve the best possible outcomes for the people in our community. So I'm grateful for everyone who has worked together in order to make this happen. And with that, I think I'm handing it over to our Police Commissioner, Joe Schaller, who will offer a couple of words on behalf of the PD. Thank you so much, Joe.
Good afternoon. So we're in the early stages in the development of this program and primarily focusing on the homeless. City of New Rochelle hasn't had a problem to the extent that some other communities have had with homeless, but we do have a group of people or a number of people who, for the most part, experiencing mental health issues who we have to attend to out there. And as a police, our primary function is law enforcement, and we don't really have the training and the wherewithal to provide any enduring solutions to this sort of problem. So we handle their emergencies, when they have emergencies, or we have to go out and correct conditions that sometimes cause inconvenience to other people in the community out there. We respond very well to those things, but we don't have the resources or the training to provide more enduring services to these people. So we're very happy and very appreciative that the county's Department of Community Mental Health has offered to partner with us in providing better service to these people. And as I said, we're in the early stages of this program, and it's hopeful we'll be able to expand it to include Mary in some of our responding to other people in the community who aren't homeless but who do have mental health issues that we've always had difficulty again providing any enduring services for. We can respond as first responders to these things, and we can refer, but it's difficult for us with all the other responsibilities we have to do any extensive follow-up. So hopefully Mary and the county's Department of Community Mental Health Services will be a resource for us. Thank you.
Thank you. Thank you again, Mayor and Commissioner, for your words and your collaboration. And we also want to thank the media for being here this afternoon, and we will have a chance to hopefully answer some questions as well. I'd like to introduce to the podium our Deputy Commissioner, Joe Glazer, who has provided leadership in this effort, and also to give a little bit more details about the program.
Thank you, Michael. Just very briefly, as the Commissioner pointed out, this model began in this county 15 years ago. In the last 2 years, under the leadership of the county executive, we've been able to expand this model into other communities now coming into New Rochelle. It is really about effective collaboration, effective use of resources to work together to better meet the needs in a community. And one of the things that we have found in partnering with New Rochelle is an eagerness on their part to help meet the needs in the community. So I applaud them for being willing to partner with us in moving this forward. We hope to be able to do this in other locations as well. But this is a model that we believe is very effective, because as the police will tell you and have told you, when we go into a community together, we have the ability to help people beyond the scope of just police training, beyond the scope of just mental health training. This is a combined effort to make sure that people are safer, that they're better connected to services, and that law enforcement gets help in an area where, in this city in particular, they've been good, but they're not experts. So the ability for us to join their expertise and ours is a very useful tool in community law enforcement. The three other communities that we're in, and I'm just going to go through it very quickly. 2019, our mental health outreach teams, which is what we call this, actually connected with 361 people in White Plains, 627 people in the city of Yonkers 4th Precinct, 179 in Greenburgh. That individual is staffed through part-time placement of one of the members of the People USA Crisis Stabilization Team working with the Greenburgh Police. And in the first 3 months, because we started this literally putting it together on the run because we all decided we wanted to get up and moving, so while it's developing, we're in the community doing what we can and working together. In the first 3 months the program is operated in New Rochelle, the initiative has served 60 individuals. So from our perspective, this is a great model for us to be able to work together. And just very quickly, I've done a number of ride-alongs in the county, and recently I did one in Yonkers. And what you see when you have a police officer and a clinical mental health worker together is this wonderful team and partnership of individuals connecting with individuals in the community. The most amazing thing for me was you're standing there with an individual that the officer and the mental health worker are having a wonderful, insightful conversation with, and they think they're just having a conversation. I know what they're basically doing is a welfare check to see how that individual is doing, if they're going to services, if they're getting the help they need, if there's anything that they're falling short. And it's a very different dynamic than anything you would experience just spending a day in the community and seeing one or the other working separately. So we're very appreciative of the ability to bring this together, and it means a great deal to us to be able to make this work.
Thank you, Deputy Commissioner Glazer. So as you can see, we're excited about this new initiative. We know it's going to have a positive impact on New Rochelle, and again, we appreciate the collaboration with the New Rochelle representatives. So at that point, that's our program. We'd like to take any questions. We're available now, or if you'd like to speak to some of the members on the podium on the side, that's also a possibility. So just wondering if there are any questions from the audience, from our news media? If not, okay, so we will stay around for a few minutes if anyone has any questions. We thank you for being here and enjoy the rest of your afternoon. Thank you.
Thank you.